Brain abscess and neuronal linkage. A brain abscess is not ordinarily a collection of pus. It is a rapidly expanding inflammatory lesions that compresses neuron, disturbs synaptic communication, damages white matter pathway, and raises intracranial pressure. As bacteria or fungi invade the brain, immune cell releases inflammatory mediator that produces edema, neuronal dysfunctioning, and sometimes irreversible network failure. Hi, my name is Dr. S, and today we are going to discuss brain abscess and neuronal linkage. Intracerebral infection that disturbs neuronal signaling through inflammation, edema, pressure, and focal circuit injury. Infection becomes space-occupying lesion that silences neuron and distorts brain network. Description: focal collection of pus within the brain. Parenchyma usually surrounded by inflammatory capsule and vasogenic edema that spreads. Contagious ENT dental infection leads to brain abscesses. Hematogenous heart and lung, and directly involved is the trauma and surgery that leads to brain abscess. The sources include the sinusitis, otitis, meningitis, dental infection, trauma, surgery, endocarditis, and lung infection. Headaches plus fever plus focal deficit and seizures must raise suspicions of the brain abscess. Mechanism: pathogenic entry that leads to Cerebritis. Neutrophil activate and their ranges go high. Necrosis. Formation of the capsule and edema and raise in the intracranial pressure. Cytokines injures neurons and glia, disturb blood-brain barrier, creates pressure and focal circuit compression. Irritated cortex becomes hyperexcitable. That is normal neuronal flow, cortex, white matter, subcortical brainstem, motor sensory output, and that is the abscesses. During the abscess, what happened? Edema, slow conduction, capsule formation, compresses axons, inflammation damages synapses, cortical irritation, and deficit dependent on location. Clinical features: frontal lobe abscess cause personality changes, weakness, seizures. Temporal lobe language disturbance, memory, and seizures. Cerebellum ataxia, vomiting, nystagmus. Brainstem, cranial nerve sign, consciousness changes, and that is if the abscess is found anywhere in the brain. That causes the headache, fever, raised intracranial pressure, altered mental status. That is the classical triad. Diagnosis: MRI, CT, and CT is carried out if there is an acute infection and abscess in the brain. That is the clinical suspicion. And that is the microbiology. Lumbar puncture. Differentials are the tumor metastasis, toxoplasmosis, and tuberculoma. That is the treatment. Empiric antibiotic use, culture, neurosurgical aspiration, drainage of the abscess, serial imaging and follow-up. For treatment, cephalosporins plus metronidazole plus vancomycin if there is a need of vancomycin. Surgical aspiration, treat primary source, and that is the sinus, ear, dental, lung, cardiac, and post-operative wound or surgery. Control seizures, raise intracranial pressure, and neurological deficit. That is the clinical cautions when the corticosteroids are used. That is the treatment goal. Prognosis, better prognosis, early diagnosis, small solitary abscess, accessible drainage, responsive organism, no coma or rupture. Delayed treatment, multiple deep abscesses, intraventricular rupture, immunosuppression. That is the possible screen. That is a summary. Infection of ENT, dental, lung, heart, trauma or surgery. Cerebritis, abscess capsule, neuronal disruption, axonal compression, synaptic dysfunctioning, and seizures. Clinical outcome, raised intracranial pressure, recovery or sequelae. That is the schematic summary. Causes, pathogenesis, clinical features, diagnosis, treatment, prognosis, good or bad, and neuronal impact of the brain abscess. That is the graphical summary. Thanks and regards. Please like and subscribe this channel for further discussion on rare diseases. Thanks.